Have you ever been told that your thyroid levels are normal but you still feel off? Because normal does not mean optimal. Are you dealing with unexplained weight gain, constant fatigue, or mood swings and feel lost despite normal test results? These could be signs that your thyroid is underfunctioning, and standard thyroid testing cannot tell you that. If you have an underfunctioning thyroid, or in other words, hypothyroidism, this is a must watch video for you. And if you don't have any thyroid issues, then this is a equally must watch for you, because I'm going to tell you how to achieve your best thyroid health and keep your thyroid tuned up for years to come. Hello friends, this is your Dr. Singh and welcome to your channel. I am so glad you are here to share such an important information about thyroid health, which is so relevant in the present time. Unfortunately, it has never been this challenging to maintain good thyroid health thanks to industrialization, toxins, pollutants, chemicals, stress, etc. But we can't give up. I won't let you give up. Let me provide you with the right knowledge, solutions, and actionable steps. First, we will talk about what we mean by optimal thyroid function. You won't get this answer from standard medical reports because they only talk about normal. But we are going to understand the difference between optimal and normal and help you understand why you might not be feeling your best even when your lab tests are saying otherwise. Number two, we will talk about signs and symptoms indicating that your thyroid might not be working at its best. Lastly, we will discuss actionable steps you can take today to achieve your best version of thyroid health. Now, you might be thinking, if I don't address these thyroid issues, what's the downside? What will happen to me? Let me tell you this. Remember this. The thyroid is not just a gland. It sets the mood for your whole body. It affects every function of your body. If your thyroid is not optimal, forget about having optimal health. It just cannot happen. Okay, let's start with our first question. So what do we mean by optimal thyroid function? And how is it different from a thyroid within the normal range? Because if you are suffering from symptoms of low thyroid, normal might not work for you. You need to go for optimal thyroid functioning. Imagine a hypothetical character, Sarah, a 35-year-old lady. She visited her doctor complaining of fatigue and weight gain. The doctor checked her labs, including her thyroid, and they all came back normal. But she knew something wasn't right. She felt dismissed and discouraged. Now, this is a very common scenario, especially in the context of thyroid care. Let's have a quick recap on thyroid hormones. So there is a hormone called TSH, which is released by your brain. It signals your thyroid gland to make the thyroid hormone T4 and T3. T4 is the inactive form and T3 is the active form of thyroid hormone. Typical scenario, when you go to a doctor for thyroid check, you will get your TSH level checked. And if it comes outside the normal range, you will get your free T4 levels checked. And that's pretty much it. If they are within the normal range, that is the end of the story. But here's the catch. These normal ranges are broad and do not account for individual differences. It's like if I tell you the average shoe size of the population is 5 to 12, so here's a shoe size 9 for you, and be happy with it. But your shoe size is 7, so although 9 is within the normal population range, 7 fits you better than 9 does. Does that make sense? So that's what we are talking about here. Okay, another point. Just imagine the thyroid gland is a factory. Okay, T4 and T3 are the workers inside and TSH is the boss on the outside. Now the boss is yelling instructions from outside the factory gates. Just because the boss is shouting normal orders from the outside does not mean everything inside the factory is running optimally. So if we don't check the actual workers, T3 and T4, and one more mysterious worker, which I will discuss in a bit, we miss the full story. So what's the deal with normal versus optimal? So normal is a range based on average population scores, not on how you feel or could feel. Optimal is where you find the best version of yourself. It's when your symptoms improve and you feel balanced. Achieving optimal thyroid function means fine-tuning your levels where your body functions best. Now that we understand the difference between normal and optimal, it brings us to our second question. What are the symptoms of underfunctioning thyroid? Remember Sarah, our fictional character from before? Now she decides to go to another doctor who understands thyroid better than her previous doctor. This time she went to a doctor who believes in personalized precision medicine. Sarah has a whole bunch of symptoms. Despite normal standard thyroid test results, which were TSH and free T4 within normal range, this doctor wants to know every single symptom she is experiencing, even the kind of stuff which Sarah believed was just normal for her, or she's just getting old, or it's part of aging. And now Sarah starts talking. Sarah feels cold when other people feel comfortable in the same room. Her hands or feet are often cold. She is struggling to find words mid-conversation, waking up tired after a full night's sleep, having memory lapses, mood swings, and not being able to concentrate, which is now affecting her work and personal life. Despite moisturizing, her skin remains dry and flaky and her nails brittle. Hair thinning has become a distressing morning routine and her face appears persistently puffy. She has under eye bags, she has gut issues, she is constipated, often feels bloated, and her digestion is slow. She experiences unexplained weight gain despite her active lifestyle and healthy eating habits. She has low metabolism and is insulin resistant. Her joints are achy and stiff in the morning, and Sarah feels groggy and sort of depressed at times. I understand. As I list all these symptoms, it's likely ringing alarm bells for many of you, but don't worry, don't be scared. The important thing is the body is very intelligent. It has its own way of giving you signals that something is going off. Now it's our job to understand and act on those signals. The body gives you signals months, years, even decades before a disease manifests. And that's what we are talking about here. How to be proactive. Don't be scared, be proactive. Use this knowledge, use this information. This is what personalized precision medicine is all about. This is what Hilenzo is about. Okay, now that you have the knowledge and understand the point, the next question is what can be done? Now, if you remember the factory story, I mentioned a mysterious worker. So that mysterious worker is reverse T3. So T4 and T3 are actual workers which get the job done. Reverse T3 is like the worker who's there but not contributing to the main job. It occupies space but does not have the same effect as T3. Reverse T3 is like the body's way of hitting the brakes on your metabolism. Normally, your thyroid makes T3, a hormone that acts like a gas pedal, speeding up your body's energy use. But when the body needs to conserve energy during stress or illness, it converts some of this T3 into reverse T3. Now, unlike T3, reverse T3 does not speed things up. Instead, it blocks the effects of T3, slowing down your metabolism. It's like your body's way of saying, let's take it easy and save some energy for later. It's normal for the body to make reverse T3 during acute illness. But here's the important point. It also goes high when you are in a state of stress or chronic inflammation. Then you end up in a situation with more reverse T3 than you need. And this reverse T3 competes with your T3 for the same receptors on the cells. Therefore, even if you have normal levels of T4 and T3 in your blood, you still might not feel quite right. You feel like you don't have enough of your thyroid hormones, not because you don't have enough, but because you have something like reverse T3, which is competing with your regular thyroid hormones. Does that make sense? So what's the first step? If you have been diagnosed with hypothyroidism, I want you to talk to your doctor about getting tested for a full thyroid profile, not just TSH or T4. Get your reverse T3, total T3, free T3, and your two thyroid antibodies, TPO antibody and thyroglobulin antibody. An integrative medicine doctor can help you with enhancing conversion of T4 to T3 or bringing the reverse T3 levels down. Now, figuring out if antibodies are positive, what are the possible triggers, controlling them to calm down your immune system, work on decreasing inflammation, and so many other factors which can contribute to thyroid not functioning properly, like high cortisol state, high insulin state, high estrogenic state. Now, if your blood tests are showing positive antibodies, it's a sign of autoimmunity towards thyroid. Detecting this early is important and gives you a better chance of normalizing these antibodies. The key point is to identify a trigger which is making you develop autoimmunity towards thyroid. This trigger could be a food sensitivity or chronic infection or gut imbalance, etc. If you are struggling with healthy thyroid hormone levels, talk to your doctor. You might be a candidate for a combination of T4 and T3. There are several available options now. Now there is a role for botanicals. There is a research out there that have shown botanicals like Ashwagandha, low dose Naltrexone and Myo-Inositol. It can help with thyroid function. They are very commonly used in integrative medicine world, but I won't go in the details at this point. Again, you can talk to a good integrative medicine doctor and figure out if botanicals can help you. But I have provided some links to the research in the description below. You can check them out. You can get familiar with that research. Okay, now the second step. Now, this is an important point, not only for people who are suffering from thyroid dysfunction, but also for everyone who wants to keep their thyroid levels healthy for years to come. Get your stress levels under control, guys. I have made several videos on how to control your stress, so go check them out. Make sure you get regular exercise, good quality sleep, and a good balanced diet. That consists of healthy fats, a good portion of protein and complex carbohydrates, as well as good and diverse amount of fruits and vegetables. Now, when it comes to thyroid health, there are 6 micronutrients that are essential, which means your body cannot make them, so you need to get them from your diet. So first one is iodine. Most of you have heard about it. So many of our foods are fortified with iodine, so this is not so much of a problem these days. But if you are struggling with not getting enough, seafood is rich in iodine. You can eat seaweed. Next is iron, which is very important and commonly deficient in females who are still having menstrual cycles. Foods like organ meats, oysters, spinach, lentils, kidney beans, white beans, and pumpkin seeds, they are rich in iron. Next important nutrient is vitamin A. Foods such as milk, eggs, cod liver oil, spinach, butternut squash, sweet potatoes, and carrots are rich in vitamin A. Next on the list is vitamin D, which is so important, but so many of us don't get enough. Go out and sun, guys. Foods with vitamin D include cod liver oil, salmon, sardines, whole milk, beef liver, and eggs. And the last 2 super important nutrients for a healthy thyroid are zinc and selenium. You need them for the conversion of T4 to T3. Zinc containing foods include pumpkin seeds, cashews, beans, oysters, and meats. For selenium, focus on Brazil nuts, sardines, shrimp, salmon, tuna, or oysters. So to summarize everything, if you are still struggling with symptoms of low thyroid function, talk to your doctor about getting an extended thyroid panel. Regardless, focus on a healthy diet with an extra emphasis on 6 key micronutrients needed for healthy thyroid functioning, which are vitamin A, vitamin D, zinc, selenium, iron, and iodine. If you have autoimmune picture, control the triggers at any cost. And lastly, if your symptoms are not controlled with synthetic T4 hormone replacement, then you might be a candidate for other thyroid hormone options. So if you haven't already, please watch my video about controlling stress through lifestyle changes, because stress is the elephant in the room. Before anything else, work on controlling the stress. Go check it out, and that's it for now. Signing off. Stay healthy, stay informed. Remember, peak of your health is your true wealth. Thank you very much.